Hello, everyone. My name is Jen, and I'm recording this online residency program for my future reference, just in case I want to review the lecture again. And today I have finished a few of the modules on my to-do list, and I'm continuing on with this topic, understanding and managing diabetes. Let's begin. 15 questions. All right, let's see. Insulin is secreted from the pancreas, a large gland in the body. True. Shaking and sweating, dizziness, and rapid shallow respirations are symptoms of hypoglycemia. True. A caregiver's role is to teach a diabetic how to care for themselves. And then the caregiver does not need to monitor the diabetic resident any longer. False. Fast sugar food increases the amount of glucose in the resident's blood. Fast sugar food. Okay, true. Hyperglycemia results when sugar levels in the bloodstream is high. Yes. Are high. Lack of exercise and obesity can put a person at greater risk for diabetes. Yes. Administrators are the only caregivers allowed to document in the MAR, medication administration record. False. All the following are warning signs of ketoacidosis. Ketoacidosis, there are ketones in the blood. Ketoacidosis occur with type 1 diabetes. So you're thinking it should be cloudy. Okay. Diabetes can develop in both childhood and adulthood. True. Diabetes is a disease that only develops during childhood. False. If a resident suffers from diabetic neuropathy, care staff can do nothing to help them. False. Residents with diabetes can control diabetes with insulin alone. False. Diet also. Diabetic retinopathy may cause blurry vision. True. Diabetic neuropathy, a type of nerve damage, most often affects the legs and feet. Yes, true. When the pancreas is not functioning properly, it may not be secreting insulin, secreting too little insulin, or the insulin that is secreted is not effective. True. Your pancreas is not functioning properly, it may not be secreting insulin, secreting too little insulin. So, let's see. What? Perfect. This is insane. I got a perfect score. Wow, I love diabetes topic. Okay. Let's record this. Okay, exit test. Understanding and managing diabetes.
Welcome to this course, Understanding and Managing Diabetes. This course provides a better understanding of diabetes, identify the signs of complications of diabetes, and properly respond to the complications of this disease. Diabetes can be life-threatening if not treated immediately by recognizing there is an emergency and providing proper care of the diabetic resident. Upon completion of this online activity, the participant should be able to have a better understanding of diabetes and why it is important to manage, identify complications of diabetes, provide proper medication management and documentation, understand how to prepare for a diabetic emergency. Chapter 1: Understanding Diabetes. Care staff care for individuals with a variety of medical conditions. Residents also may take many different medications to manage medical conditions. This course focuses on residents with diabetes. A person's appearance does not signal whether a person has diabetes. Most people with this disease live a very full life and manage the diabetes on their own. When a person lives in assisted living, caregivers may help manage diabetic diets and medications. The information in this course explains diabetes and helps care staff identify signs of complications and how to properly respond to diabetes complications. The complications of diabetes can be life-threatening if not treated immediately. Caregivers need to recognize an emergency and provide proper care for the diabetic resident. Caregivers have a variety of responsibilities, which may include knowing a resident's diagnosis, following the care plan, and managing treatment plans. Caregivers should always review expectations with the manager. Clarifying expectations and understanding special needs of each person results in the best quality care. Diabetes is a disease that can develop in childhood and adulthood and is defined as the inability of a person's body to change carbohydrates into energy. Carbohydrates are food that contain starches and/or sugars. Some foods that contain a high amount of carbohydrates include potatoes, pasta, baked goods, candy, breads, fruits. The two main types of diabetes are type 1, which is insulin-dependent diabetes, typically develops before age 30. Type 1 diabetes occurs when your body doesn't produce enough insulin, a hormone secreted from the pancreas. The decreased insulin in blood vessels leads to increased glucose that cannot be used by muscles. Ketoacidosis can occur when glycogen and protein in the muscles break down. Type 2, which is non-insulin dependent diabetes, typically develops after age 30. With type 2 diabetes, a sufficient amount of insulin is released into the bloodstream from the pancreas. The muscle, however, is unable to use the glucose due to insulin resistance. Insulin resistance can result from obesity, inheritance, and other factors. Did you know that type 2 diabetes is the most common and accounts for 90% of all diabetes worldwide? The cause of diabetes is unknown, and currently there is no cure. Family history, being overweight, and lack of exercise puts a person at greater risk for developing diabetes. Diabetes can be controlled through medications, diet, and exercise. A healthy body changes carbohydrate into energy. Typically, when food is absorbed into the system, starches and sugar are changed into glucose. Glucose enters the bloodstream where it acts as fuel. This fuel gives a body the energy needed for daily activities, just like gasoline gives a car the fuel to make it run. The body produces insulin, which is sent through the body by the pancreas when a person eats and food is digested. Insulin helps glucose enter the body cells. Without insulin, a person cannot get the needed glucose for energy and cannot function normally. Insulin also keeps blood glucose levels balanced in the body. When there is too much glucose in the bloodstream, insulin is the body's way of storing the extra in the liver. When glucose is low, the stored glucose is released. Insulin allows the right amount of glucose to leave the bloodstream, the right amount of glucose to enter each of the body's cells. Without insulin, glucose cannot be absorbed into the body's cells. When this occurs, glucose backs up and builds up in the bloodstream, causing significant health problems. If glucose cannot get into the body's cells will deteriorate. The body's cells may die. If a person has diabetes, their pancreas is not properly functioning. A pancreas that is not functioning properly cannot produce insulin, makes too little insulin or not enough insulin. Which of the following is accurate about insulin? Choose the best answer and click Submit. Insulin prevents glucose from entering the bloodstream. Insulin allows glucose to be absorbed into the body's cells. Insulin is produced by the liver when a person eats. Glucose is created by unused insulin in the body's cells.
Insulin prevents glucose from entering. No, insulin allows glucose. Insulin allows glucose to be absorbed into the body's cell. Wait, insulin prevents glucose from entering into the bloodstream.
That's not quite right. The pancreas.
Wait. Go back.
Chapter 2.
Insulin allows glucose to be absorbed into the body cells.
Without insulin.
Insulin allows glucose to be absorbed into the body cells. Can I repeat that? Oh no, I can't repeat it anymore.
Without insulin, glucose cannot be absorbed into the body's cells. When this occurs, glucose backs up and builds up in the bloodstream, causing significant health problems. If glucose cannot get into the body's cells will deteriorate. The body's cells may die. If a person has diabetes, their pancreas is not properly functioning. A pancreas that is not functioning properly cannot produce insulin, makes too little insulin or not enough insulin.
The answer is insulin allows glucose to be absorbed into the body cell.
Chapter 2. The importance of controlling blood glucose levels. Persons with diabetes need to keep the disease under control to avoid other health problems, such as blindness, kidney failure, nerve damage, high blood pressure, and circulatory disorders. Circulatory disorders can lead to stroke, heart attack, and slow wound healing. A caregiver's role is to observe residents for any changes in normal behavior. Since caregivers spend a lot of time with residents, they may be the first to notice when a resident is not feeling well. The Americans with Disabilities Act states 4 facts about individuals with diabetes. 1. Adults with diabetes are significantly more likely to die from a heart attack or stroke. 2. More than a quarter of all Americans with diabetes have diabetic retinopathy, which can cause vision loss and blindness. 3. Each year, nearly 50,000 Americans begin treatment for kidney failure due to diabetes. Diabetes accounts for 44% of all new cases of kidney failure. 4. Each year, diabetes causes about 73,000 lower limb amputations, which accounts for 60% of all lower limb amputations. 2 symptoms to watch for when observing a resident with diabetes include 1. Hyperglycemia, which is too much sugar in the bloodstream. 2. Hypoglycemia, which is too little sugar in the bloodstream. Hyperglycemia occurs when too much glucose is in the resident's system and not enough insulin or diabetic medication is in the bloodstream. Glucose can build up in the bloodstream and become dangerous if a person eats too much, exercises too little, or has an infection and becomes ill. Some symptoms of hyperglycemia might be weakness, drowsiness, frequent urination, leg cramps, slow, deep, and labored respirations, low blood pressure, headache, blurred vision, nausea and vomiting, behavior changes such as nervousness or agitation. Scenario: Elsie is an insulin-dependent diabetic resident. Every morning, the caregiver assists Elsie with dressing. One morning, the caregiver knocks on Elsie's door, but she does not call out for the caregiver to enter as usual. The caregiver enters Elsie's room and she is still in bed. It is apparent that she is breathing. The caregiver calls her by name and gently shakes her shoulder, but Elsie does not wake up. Elsie may be in a diabetic coma. The role of caregivers is to monitor residents and observe changes in condition. Observed changes must be reported to the nurse or supervisor immediately when a diabetic emergency is suspected. Care staff must check a diabetic resident's glucose level as required in the care plan. This is usually done prior to meals and bedtime. Assist the resident, if necessary, to administer needed medication and document any observed changes and actions taken by care staff in the resident care plan. Hypoglycemia occurs when too much insulin or diabetic drugs are in a person's bloodstream. Hypoglycemia can occur by skipping or missing a meal, eating too late, eating too little, increased exercise, vomiting, or drinking alcohol. Hypoglycemia is one of the most common complications of diabetes. Hypoglycemia occurs very quickly when blood sugar levels fall too low. When this happens, the resident's normal condition begins to change and the following symptoms may occur: hunger, fatigue and weakness, trembling, shakiness, irritability and confusion, sweating, skin is cold and moist, headache, dizziness or fainting, the resident seeming clumsy or jerky, tingling around the mouth. Scenario: a caregiver is talking with Fred, an alert and oriented resident, about his recent visit with his daughter. During the conversation, Fred seems happy and appears to be feeling well. Suddenly, Fred begins to perspire and his hands begin to shake. He also starts talking as if he is confused by saying, "Do you know my daughter? I must visit my daughter. Did you know I saw my daughter today?" All the signs exhibited by Fred are symptoms of hypoglycemia. When signs of hypoglycemia are noticed and suspected, treat it as an emergency. Hypoglycemia may be life-threatening and may lead to insulin shock. When a caregiver thinks a resident is in an insulin shock, stay with the resident. Check the resident's vital signs, including blood glucose level. If levels are low, follow standard diabetic first aid to treat the person. More information is provided on care during a diabetic emergency in the next chapter. A minute to ponder. Hyperglycemia and hypoglycemia are two serious, sudden illnesses that, if left untreated, could result in a coma or death. Take a moment to list all residents in your care that have a diagnosis of diabetes. Do these individuals typically have low or high blood glucose levels? Are you confident in actions to take if these situations occur? A resident with diabetes tells you that they have been feeling more drowsy than usual lately. You ask if they have had any other unusual symptoms, and they admit they have had some issues with blurry vision and nausea. What might you be concerned about? Choose the best answer and click Submit. Hypoglycemia, hyperglycemia, diabetic coma, too much insulin.
Too much insulin is hypoglycemia, and too much insulin is also hypoglycemia. Drowsy than usual, and blurry vision and nausea are both signs of hyperglycemia.
That's right, you chose the best answer. With hyperglycemia, a resident has too much glucose, but not enough insulin or diabetic medication in the bloodstream. A buildup of glucose can be dangerous and includes symptoms such as weakness, drowsiness, frequent urination, leg cramps, labored respiration, low blood pressure, headache, blurry vision, nausea, and behavior changes. Chapter 3: Medication and Diabetes Management. When a resident has a diabetic emergency, the caregiver's role becomes critical. Assist the resident to sit or lie down and check the resident's glucose level. If, after checking the glucose level, it is indeed low, give the resident something to eat or drink that is high in sugar and will quickly enter the bloodstream. Food and drink high in sugar increases the amount of glucose in the resident's blood. Alert a supervisor or nurse about the emergency, steps taken, and discuss next steps. Examples of some quick high-sugar items would be orange juice or grape juice, table sugar mixed with water, honey, or maple syrup. Diabetic residents may also have physician-ordered glucagon or glucose tablets listed in their care plan. Glucagon and glucose tablets can be administered for low glucose levels. Checking blood glucose level is important in managing diabetes, as well as determining a plan of care in an emergency when blood sugar levels are too low or too high. Taking a resident's blood glucose levels involves taking a drop of blood, generally from the finger. Machines are available that allow a blood sample from other areas, such as the arm. The first step in checking the blood glucose is gathering together all the necessary equipment needed. The glucometer, which contains a lancet, the cartridge that holds the lancet and test strips, gloves, alcohol wipes, the sharp container, medical administration record. The glucometer is a battery-operated machine used to measure the resident's glucose level from the drop of blood on the test strip. The cartridge is a tube for holding the lancet. In the cartridge is a spring, and when this is released, the lancet pierces the resident's skin using just the right amount of pressure. A lancet is a sharp, pointed instrument. The lancet is used to pierce the skin of the resident's finger to obtain blood. A blood sample is needed to check the blood's glucose level. The test strips have a substance on them to test for glucose in the blood. A drop of blood is placed on the strip. Steps care staff must follow when checking a resident's glucose level include: Step 1. Check the right resident. Verify the correct person. Ask another staff member if unsure who the resident is. Look at the picture of the resident provided in their chart. Step 2. Check for the right time. Check the medication administration record, MAR, to verify that it is correct day of the week and correct time of day for the glucose level check. Step 3. Check the resident's care plan or physician order for the acceptable glucose level range. Typically, an acceptable range for blood glucose level is between 70 milligrams per deciliter and 120 milligrams per deciliter. Step 4. Explain to the resident what will be done and provide as much privacy as possible. A caregiver might say something like this: Elsie, I am here to help you check your glucose level, and encourage the resident to move to the nurse's station, their room, or another quiet location within the assisted living. Step 5. Wash hands to control the spread of germs. Gloves must be worn since blood is involved in this process. Step 6. Insert the lancet into the cartridge and ask the resident if they have a preference which finger should be pricked. Do not select the same finger that was used the last time a glucose check was done to prevent unnecessary discomfort. Also, check to make sure the finger is not calloused. The lancet may not pierce through calloused skin. Step 7. Cleanse the finger that will be pricked with an alcohol wipe. Wait 20 to 30 seconds for the alcohol to dry. If the alcohol does not dry, it can alter the glucose level. Step 8. Pick up the cartridge and gently squeeze the resident's fingertip between your first finger and thumb. Place the tip of the cartridge firmly against the side of the resident's fingertip and release the spring of the cartridge. This allows the lancet to prick the resident's finger. Release your fingers from the resident's fingertip. Step 9. Allow 1 drop of blood to fall onto the test strip and insert the test strip into the glucometer to get a blood sugar level reading. While waiting for the glucometer to read the test strip, discard the lancet into a sharps container, wipe the blood off the resident's finger with a cotton ball, and dispose of the cotton ball in the appropriate container. Clean the tip of the lancet cartridge with an alcohol wipe and dispose of the alcohol wipe in the appropriate container. The glucometer beeps when the glucose level is ready to be read. When the glucose level appears on the glucometer, take the test strip out of the glucometer and discard it in the appropriate container. Remove gloves and discard them in the appropriate garbage container. Wash hands after removing gloves. Record the blood glucose level in the medication administration record, verifying the correct resident. Report a glucose level that is not within the required range to the nurse or supervisor so that steps can be taken to maintain the person's health. Residents with too much sugar in the bloodstream or hypoglycemic may require medications that lower the amount of glucose in the bloodstream. Residents that have diabetes but do not require insulin can control their diabetes with proper diet, exercise, and oral hypoglycemic medications. Medication dosage and frequency varies depending on how well the medication controls a resident's diabetes. Oral hypoglycemic medications must be taken 30 minutes before meals. Some diabetic residents can control diabetes with oral medications. Oral medication is less painful than injections and is more convenient. Diabetic residents may have his or her health affected by food choices. Caregivers need to be aware of special diets when preparing and providing resident meals. Reminders, education, and encouragement help a person maintain their diabetic diet. If a diabetic resident has a doctor requesting a diabetic diet, special meal planning is needed. Diabetic diets require the monitoring of carbohydrate, sugar, and protein intakes, since these foods can affect blood glucose levels. Exercise is activity over and above normal daily activities. For example, a person starts walking around the block on a regular basis and increases distance each time he or she walks. This is considered exercise because it is something over and above the normal daily activities. Exercise, added to a person's daily routine, can affect blood glucose levels. A resident with diabetes may need to eat more or have additional snacks to maintain normal blood glucose levels when they exercise. Diabetic residents in assisted living have meals prepared for them with proportions required for special diets. A person typically is offered 3 meals a day and generally 2 snacks. An additional snack may be needed before bed to maintain insulin and blood glucose. Residents with health concerns such as diabetes need to be closely monitored. Types and amounts of food eaten at each meal and snack time must also be monitored. Diabetes, if not managed well, can lead to life-threatening complications. Caregivers are part of a team that provides care residents need to maintain ideal health and reduce chronic illness decline. A minute to ponder. Some residents may refuse their medication, including diabetic medication. Their doctor must be notified within 2 days if they continue to refuse medications. A best practice is to notify your supervisor or nurse after any refusals of medication. Think for a moment of residents that refuse medications. What can you do differently to encourage them to take all medications? Before inserting the lancet into the cartridge, it is important to do which of the following. Choose the best answer and click Submit. Ask the resident for their glucose level range. Make sure the resident has a snack. Massage the resident's hands to increase circulation. Practice hand hygiene and put on gloves. That's right, you chose the best answer. Before inserting the lancet into the cartridge, staff should wash hands to control the spread of germs and put on gloves. Chapter 4. Considerations for Resident Care. Care staff face a challenging situation when a resident has diabetes and a cognitive impairment. Neither is easy, but together they bring special challenges for assisted living caregivers. 5 common health concerns associated with diabetes are introduced next. Diabetic concerns of a resident with dementia or another type of cognitive impairment presents caregivers with specific considerations. What to consider when a resident has high glucose readings? Are AccuChecks administered as ordered? Are managers advised when levels are outside the normal range? Are they taking medications according to schedule? Are they eating appropriately nutritious food? Is the resident's appropriately nutritious according to schedule? Are they taking medications according to schedule? Are they eating appropriately nutritious food? Is the resident's carbohydrate intake being considered? If the answer is yes to all questions regarding consistent high glucose readings, a resident should see a physician. The questions help determine if a change in resident condition occurred. Diabetic neuropathy is a type of nerve damage that can occur with diabetes. The condition most often affects the legs and feet. Symptoms include pain and numbness in the legs. In more severe cases, symptoms include issues with digestion, the bladder, and controlling heart rate. For some people with diabetic neuropathy, symptoms are mild. For others, symptoms can be painful, debilitating, and even fatal. Treatment includes managing blood sugar and using medications to control symptoms. What to consider when a resident has a diabetic neuropathy? Are caregivers using techniques to improve circulation? Are residents able to advise staff of increased numbness and pain? Are caregivers able to make adjustments to compensate for numbness and pain? Is the resident properly using devices and mobility aids? Is the resident taking medications according to schedule? Residents suffering with pain or numbness in the legs or feet are at a great risk of falls. Diabetic neuropathy needs to be monitored closely by a physician. One way to manage neuropathy symptoms is to effectively manage diabetes. Diabetic retinopathy is a complication of diabetes that affects the eyes. This condition is caused by damage to the blood vessels in the tissue at the back of the eye, known as the retina. Poorly controlled blood sugar is a risk factor. Early symptoms of diabetic retinopathy include seeing floaters, blurriness, dark areas of vision, and difficulty perceiving colors. Blindness can occur if the person's diabetes is not managed. What to consider when a resident has diabetic retinopathy? Are residents advising staff when vision changes? Are residents taking medications according to schedule? Do residents need special adaptive equipment or low vision aids to facilitate independence and ensure safety? Mild cases of diabetic retinopathy may be treated with careful diabetes management. Advanced cases may require laser treatment or surgery. Vision changes add to increased risk of falls. Consider the following questions when a resident has foot issues. Are caregivers checking for new sores and ulcers daily? Are medications applied according to schedule? Are residents' feet kept clean? Will residents wear proper shoes? Wearing proper shoes and keeping feet clean are an important part of diabetes management. Since diabetics may have poor circulation, sores can take a long time to heal and are known to reoccur. About a third of people with diabetes develop skin problems at some point. The most common skin problems are fungal infections, bacterial infections, and localized itching. Infections can occur anywhere on the body, but are most common in nails, armpits, groin, and moist folds of the skin. What to consider when a resident has skin issues? Are caregivers providing regular skin checks? Are managers advised when new lesions, sores, or rashes appear? Are medications applied according to schedule to keep the resident's skin clean? Most skin conditions can be treated easily if caught early. Taking all medications, including diabetic medications to control blood sugar glucose, can prevent skin problems. Diabetes is common in assisted living. Care staff play an important role in helping residents effectively manage their diabetes. Which of the following is an early symptom of diabetic retinopathy? Choose all that apply and click Submit. Blurriness, changes in eye pressure, dry eyes, difficulty perceiving colors.
Is it blurriness or difficulty perceiving colors? Oh no, early symptom of diabetic neuropathy, retinopathy. I heard difficulty perceiving colors. I'm not sure. Is it blurriness? Whatever.
That's not quite right. Early symptoms of diabetic retinopathy include blurry vision, the
Blurry.
presence of floaters, dark areas of vision, and difficulty perceiving colors. Without proper management, the individual can experience blindness.
Wait, difficulty perceiving colors is one of the options. Early symptoms difficulty perceiving colors, blurry visions. Wait,
Chapter
which of the following is an early symptom of diabetic retinopathy? Difficulty perceiving colors. Isn't that one of the answers? And blurriness.
Most skin conditions can be treated easily if
Anyway.
Chapter 5, Preparing for Diabetic Emergencies. As a caregiver, it is likely that you will care for a person who is diabetic. It is important to understand the disease, the medications, and what to do in case of an emergency. Regardless if a resident has type 1 or type 2 diabetes, there may come a time when blood glucose levels become too high or too low. Do you know how to treat the emergency for each person with oral medications, insulin injections, or something else? Testing blood glucose levels typically takes place multiple times each day. It is important to understand the test results. Dangerous blood glucose spikes and drops can catch people by surprise. Medication passers need to know the following information about every resident they are administering diabetic medications. What medications the individual takes, what the side effects of those medications can be, what to do in case of a severe high or low blood glucose, how to identify warning signs of hyperglycemia and hypoglycemia. Low blood glucose measurement is typically experienced at less than 60 milligrams per deciliter. Signs of low blood glucose include dizziness, blurred vision, headache, shaking, rapid heartbeat, sweating, irritability, drowsiness. Signs of low blood glucose vary for everyone. If a person has specific symptoms experienced when blood glucose levels drop, the information should be available to read in the person's care plan. If specific symptoms are not known, they can be added after a diabetic emergency. Other symptoms can include difficulty in speaking and numbness or tingling of the face and lips. As glucose levels fall further, confusion, bizarre behavior, and even unconsciousness and seizures can result. As a reminder, if the person is conscious and has typical symptoms of a low blood glucose level, Have the resident eat or drink a quick-acting carbohydrate to elevate the blood glucose level. If the resident has an order for glucose tablets or gel, follow the directions and administer these immediately. Other alternatives include a half cup of regular soda, fruit juice, or skim milk. Use the rule of 15. Take 15 grams of carbohydrates, wait 15 minutes, and test blood glucose. Have the person repeat until he or she is out of the low zone. A common practice is to notify the person's physician after following this rule twice during the emergency. If the individual is unconscious, call 911. Someone who is unconscious should never be given food, drink, or insulin. If there is a glucagon injection kit for the resident and you have been trained on how to administer it, do so. As learned in a previous chapter, signs of high blood glucose may include increased thirst, increased urination, blurred vision, dry skin, and drowsiness. Persons with chronically high blood glucose of 180 milligrams per deciliter or more may not display the same symptoms as someone dealing with a dramatic spike. Signs of high blood glucose may appear slowly and might be missed. In addition, every person's high-low symptom is different. Persistent hyperglycemia in a person with type 1 diabetes may be the result of diabetic ketoacidosis, a serious complication of type 1 diabetes. This means ketones build up in the body because not enough insulin is available. Ketoacidosis can lead to diabetic coma. Warning signs include nausea, vomiting, severe fatigue, confusion, altered mental status, and fruity-smelling breath. This condition requires prompt medical attention. Encourage the person to drink plenty of water and administer blood glucose-lowering medications as prescribed. If the person takes rapid-acting insulin and has instructions for correcting a high, the medication passer should follow the administration directions. Some people with type 2 diabetes can lower blood glucose levels with exercise, such as a walk. Keep checking blood glucose until levels are clearly dropping. Sudden illness and infection may cause blood glucose to rise. If a resident is ill with high blood glucose measurements, continue to check blood glucose levels often and administer medications as prescribed. When diabetes is not managed well, regular changes in insulin may be ordered by the person's physician. Always read the label of the medication and compare the information listed on the medication administration record, MAR, to make sure they match. Follow the parameters designated by the person's physician for blood glucose levels that insulin should not be administered. If information differs from MAR and the prescription label, stop. Do not administer the medication until clarification is received. Documentation of medication administration is required. Include any comments the resident may state that could indicate an illness, high blood glucose, or low blood glucose. Some examples of comments to report and document. A resident tells you they just came back from a long walk and they have not walked in years. This could be a signal to watch for symptoms of low blood glucose. A resident mentions they feel like they are coming down with a cold. They are feeling tired with body aches. This could be a signal to watch for symptoms of high blood glucose. A resident expresses happiness of being able to go out to lunch with family. The story includes what they ate for lunch, including 2 pieces of apple pie. This person refuses doctor orders regularly and is difficult to manage. This could be a signal to watch for symptoms of high blood glucose. In case of emergency or not, caregiver support is still key. Keeping blood glucose on target is time-consuming and often a frustrating task when a resident is uncooperative with diet and exercise. A minute to ponder. Diabetic residents may have a glucose paste or tablets to take as a PRN in a diabetic emergency. Which residents have this medication that can be administered in an emergency? For residents that do not have a medication to administer, what type of care will you provide? Encourage each resident to follow their doctor's recommendations, take medicine as prescribed, and test blood glucose as ordered to maintain health. When following the Rule of 15, a staff member should do which of the following? Choose the best answer and click Submit. Give the resident 15 grams of carbohydrates and 15 grams of sugars before testing blood glucose. Give the resident 15 grams of protein, wait 15 minutes, then test blood glucose. Wait 15 minutes before giving a resident 15 grams of carbohydrates and testing blood glucose. Give the resident 15 grams of carbohydrates, wait 15 minutes, test blood glucose levels. That's right, you chose the best answer. To follow the Rule of 15, when a resident's blood glucose level is low, give them 15 grams of carbohydrates, wait 15 minutes, then test blood glucose. Repeat these two steps until the person no longer has a low glucose level and notify the person's physician after following the rule twice. Thank you for joining us for this course. You may now review the course or exit to take the quiz.
Exercise added to a resident's daily routine is healthy, but it can affect blood sugar levels. True. Diabetic retinopathy may cause blurry vision. True. Residents with diabetes can control diabetes with insulin alone. False. They can control it with their diet too. Diabetes does not affect how a person behaves. False. It affects how the person behaves. The resident's individual glucose testing kit contains all. The resident's individual glucose testing kit contains all. A lancet. Cartridge that holds the lancet, medication administration record, test strips, glucometer. I forgot to take screenshots. How many minutes should oral hypoglycemic medication be taken before meals? 15 minutes before meals. How many minutes should oral hypoglycemic medication? 15 minutes before meals. Insulin is secreted from the pancreas, a large gland in the body. True. Resident with diabetes may need to eat more. Have additional snacks to eat more or have additional snacks to maintain normal blood sugars during exercise. Resident with diabetes may need to eat more or have additional snacks to maintain normal blood sugars during exercise. True. Effective cartridge tip placement when obtaining glucose blood sample testing is the side of the fingertip. Effective cartridge the side of the fingertip. Hyperglycemia results when sugar levels in the bloodstream are high. True. When the pancreas is not functioning properly, it may not be secreting insulin, secreting too little insulin, or the insulin that is secreted is not effective. True. If a resident suffers from diabetic neuropathy, care staff can do nothing to help them. False. Administrators are the only caregivers allowed to document in the MAR. False. Fast sugar food increases the amount of glucose in the resident's blood. True. Which of the following are signs of low blood glucose? All of the above. Okay, I got 100% earlier. Oh, 30 minutes. Sorry, I forgot my answer. My answer is 30 minutes. My goodness. Can I retake it? My 3% evaluation. Okay. To discontinue education and meet the learning objectives, yes. Okay, evaluation's done. And I am done too. NA. See evaluation. View my completions. And this recording is complete. Thank you for watching. Bye.